Hi, my name is Dr. Eric Cohen.
And I'm Dr. Vidya Anagundi.
And we are the pediatricians over at Next Generation Pediatrics. Over the years, we've noticed a trend to the questions and concerns that families have brought to us regarding their children. In response to this, we'd like to put together a series of videos that are going to kind of address these questions and concerns, but in familiar, everyday talk rather than doctor speak, and hopefully give you tools that you can use in order to take care of your children in the future.
So our first video, we will be reviewing the flu virus. And in order to do that, we have asked Dr. Nicholas Bennett, who is a medical director of infectious disease at Connecticut Children's Hospital. Thank you very much for visiting us.
Thank you.
Thanks, Eric.
I think to start, we were hoping that maybe you could just begin with telling us the signs and symptoms of the flu.
So for most people, the flu starts off as a mild cold, is what it feels like. You get the runny nose, cough, fever, but it can then progress, and you definitely know you've kind of got the flu virus. You feel generally unwell. The fever may be higher than what you're used to experiencing, and aches and pains are a really big deal, muscle aches. These are things that kids may or may not complain about. The older teens and adults certainly do notice the muscle aches. Kids have experienced some of the gastrointestinal symptoms, diarrhea, sometimes vomiting. So if you have that kind of mix of symptoms in the winter with some respiratory stuff and some diarrhea mixed in, flu's usually your man.
And how would you distinguish the flu from the common cold? I mean, families often ask us, I don't know if he has a cold, I don't know if he has the flu. You know, how do we know the difference?
So early on, you may not be able to know the difference. They're very similar. I joke that with some people, if you think you've got the flu, you probably don't have it. You know it when you've got the flu because you feel really crummy. People who have been immunized generally feel a little bit better with it. People who are unimmunized, people who have underlying medical problems may get much sicker. So as a general rule, the flu just makes you feel crummier.
So when kids start feeling sick, when should the parents bring them in to see a doctor?
So my threshold for bringing kids in is sometimes somewhat based on how young they are. The younger your babies tend to do worse with the flu. Kids who have underlying asthma or immune problems are sicker. So the reasons for bringing you in would be if you were getting behind in your fluids. So babies in particular, with the higher fever, if they're breathing a little faster, they're going to lose more fluid, and they may not be eating and drinking as much as they normally do. So the risk of getting dehydrated is higher. The higher the fever, honestly, doesn't matter much, so I don't worry so much about that. But the respiratory problems, so if kids are breathing hard, breathing fast, having problems there, that's a red flag to have someone come in, maybe listen to the lungs, check them out. And certainly anyone with underlying problems should have a slightly lower threshold for bringing their kids in, because you may want to get on top of it before they get into trouble.
We definitely, have that issue with the fever part of it. I know a lot of people come in and they talk about, oh, my child has a high fever. How high should the fever be before we should worry? And we try to tell them that the fever helps us out. It helps to take care of the flu. It helps to kill the flu virus off. And I tell them if they're going to be using Motrin or Tylenol or Advil or something like that, they should do it more based on the symptoms of the child rather than the fever itself. That kids will have, as you said, a high heart rate, they'll be breathing faster. That's all a normal part of a fever, but it's not something that endangers them. Do you have a number for the fever that you think parents should be worried about, or what's your take on fevers?
Flu viruses hate high temperatures, so they don't grow well in the presence of a fever. So no matter how bad you feel, believe me, the virus feels a whole lot worse faced with that. It just doesn't grow well, and it gives your immune system a chance to get on top of it. So the fever is a good thing, but having said that, if you need to treat it for other reasons, the kids just aren't eating, aren't drinking, are very clingy and feeling crummy, then definitely it's worth doing, because it can make them just get through the day a bit better.
So when is it too early to get immunized? And when should families start immunizing their children?
There really isn't a too early period. The vaccine immunity lasts at least a year or so. By that time you need the new vaccine anyway. So if the vaccine's out, you should get it. I got a page on the way down here this morning saying the flu vaccine clinic at CCMC is open for staff. So they're immunizing the staff at Connecticut Children's as we speak, which is kind of cool. The vaccine strains are chosen back in February of the year that the vaccine's released. because they have to look at what strains are circulating in the rest of the world and make an educated guess as to what we're going to see that year. It is a guess, you can get it wrong sometimes. The virus mutates very easily. For the first time this year, we're going to have 4 strain vaccines where you've got 2 A's and 2 B's, and so there's taken a bit less of the guesswork out of what we're immunizing against.
And what about to the people that say, I don't get the flu vaccine because I always get sick afterwards, or they say it doesn't help me because I always get the flu afterwards anyway?
So you can't really get the flu from the flu shot. The flu shot itself is a killed virus. You may feel slightly unwell with fever, you may have injection site soreness, but that's really it. In fact, 1 year I delayed getting my flu vaccine. I went to the clinic and I had to go somewhere else, and I caught a cold that week. So if I'd gone to get my flu shot, I would have thought it was from the vaccine. The nasal spray is a live virus. It only grows in the nose. It doesn't grow in the lungs. And that can cause a mild infection. So you may have a runny nose, you feel a little more unwell than you would with the shot, but the nasal spray is more effective. It's more protective than the shot. We know that for kids. The downside of the nasal spray is you cannot give it to kids who have asthma or kids who have immune deficiencies because of the fact that it's a live virus. So ironically, the best vaccine you can't give to the kids who need it most. There's also egg-free this year. That's another key thing. So you kind of got a little shopping a shopping cart of vaccines this year. You've got your trivalent with 3 strains, your quadrivalent with 4 strains, you've got your egg-free, you've got your nasal sprays, all sorts.
Does the egg-free come in both, or is it just the trivalent?
I think the egg-free, I know it's egg-free quadrivalent.
Quadrivalent.
Yeah.
And some kids have to get the vaccine twice. How
Right.
do we decide that?
So it's based on your age and your previous history of immunization. So the vaccine, because it's not the best vaccine we have, you do need a couple of shots back to back to kind of boost the immune response up. The first vaccine will give you some protection. The second one gets you up to as good as we can get. And for kids who've had the vaccine the year before, you can piggyback on that pre-existing immunity, on that previous memory of what happened last year. Even for kids, though, who've had the flu, you should still get immunized. Because remember, you got infected with 1 strain. The vaccine's got another at least 2 or 3 strains in there, so you want to get that protection. So having the virus itself, unfortunately, doesn't exempt you from getting the vaccine. And some kids do need more than 1 shot, particularly the younger kids who don't mount as good immune response anyway. And kids who've never had a flu vaccine before, in their first season should get 2 vaccines.
I think the key that I try to discuss with my patients is that it's really prevention.
Right.
How to prevent it, from yourself catching it, and how to prevent other people from catching it from you. Can you go through, I know we have the vaccine, and then there's some things like hand washing and such.
Right.
Can you kind of go through those for us?
Yeah, so prevention is key because the treatment is crummy. And you feel crummy when you have the flu. So the vaccine is pretty effective. It is perhaps the least effective vaccine we have, but you're still talking about 60-70% protectiveness. So what I mean by that is if you have 2 groups of people and you immunize one and you don't immunize the other, if out of the first group who get immunized, 100 people are exposed, maybe only 30 of those will get infected out of 100 of the unimmunized group. So you're still going to get some breakthrough infections, but you've reduced the total number of people who got that sick. And even if you do get infected with the flu, you may not get as severe symptoms. So for most of the kids that I've seen in the hospital, with maybe one exception, who were really ill with the flu, were unimmunized. It's very unusual to find a kid who's immunized and then who gets the flu and ends up in hospital as a result of that.
Well, thank you very much. I really appreciate your coming down here and helping us out with this today.